Hello dear students, very good afternoon. Today I am going to discuss about the antimetabolites, anti-cancer agent. In last lecture we had discussed about the anti-cancer agents classification and the drug affecting on the cell cycles and the specific drugs belongs to the various class of cancers like antimetabolites, alkylating agents, miscellaneous agents, and there are another hormonal class which is now currently used as a anti-cancer agents. Okay. So, in today's lecture we are going to discuss about the classification of anti-neoplastic agents according to the cell cycle, introduction to antimetabolites, types of antimetabolites, common mode of action of antimetabolites. Then we will discuss of mode of action, side effects, and drugs belongs to the various subclass of the antimetabolites like folate antagonist, purine nucleotide antagonist, pyrimidine antagonist, DNA polymerase inhibitors, and other agents work as a antimetabolites. So, just I would like to revival of what we had discussed in previous lecture. So, there is a cell cycle with classification of anti-neoplastic agents using different phases listed. Okay. So, there are total 4 phases: G0 phase you can see here, then S phase, synthetic phase. Most of the antimetabolites affect on the S phase, then G2 phase in which antibiotics, prophylotoxin derivatives are going to give effect on the G2 phase. Then drugs belongs to the antimicrotubular topoisomerase inhibitors and vinca alkaloids act on the mitosis phase, and the alkylating agents will act from G1 to G2 phase. Okay. So, this is the all about the drug specificity in related to the cell cycle. So, this is the common classification of anti-cancer agents, alkylating agents in which there is cyclophosphamide, cisplatin, melphalan, antimetabolites. This is the common drugs, methotrexate, 5-fluorouracil, gemcitabines, etc. Natural products like etoposide, paclitaxel, vincristine, etc. Then anti-tumor antibiotics like bleomycin, doxorubicin, daunorubicin, hormonal agents like glucocorticoids, estrogen, progestin, and anti-androgens. This hormonal agent is specifically used for the hormonal type of imbalance and the causes of cancer due to the some level of hormone increase or decrease. Then there is a miscellaneous like arsenic trioxide, hydroxylurea, L-asparginase amino acid. Then signal transduction inhibitors like imatinib and gefitinib, etc. Okay. These all are the IgM immunomodulators drug. Now recently it was used in the treatment of cancer. Now we are going to discuss about the antimetabolites. Introduction. So, antimetabolites are structurally related to normal compounds that exist within the cells. Means generally the basic nucleic acid in our cell is DNA, okay, and the antimetabolite drugs and its analogues are specifically related to the DNA and RNA nucleotides or nucleic acid, and antimetabolites do they generally interfere with the availability of normal purine or pyrimidine nucleotide precursors either by inhibiting the synthesis or by competing with them in DNA or RNA synthesis. Their maximal cytotoxic effect are in S phase, okay, and it is cell cycle specific. So, for these antimetabolites I give one example which is better understanding, which is give the better understanding to you. It is that in our DNA there are 2 type of base, pyrimidine base and purine base. Okay. So, if we consider the purine, then adenine, guanine is purine nucleotides And if we consider the pyrimidine base, then there is a uracil, cytosine, thiamine, this type of pyrimidine base present in the DNA or RNA nucleoside. So, antimetabolites like a purine analog. So, example is a mercaptopurine, thioguanine. It is an analog of adenosine or guanine, and instead of these normal natural nucleotide, they are inserted into the DNA synthesis process, and by the false intermediate, the chain termination of the DNA synthesis was take place, and due to this they produce the anti-cancer effect. The design of several anti-cancer agents have been based on the antimetabolite theory, because cancer result in over proliferation and uncontrolled cell growth. Antimetabolite drug designed against cancer have been based on inhibiting DNA synthesis in this cell. So, this drug have been targeted against those enzymes including the nucleic acid polymerase, thymidylate synthase and dihydrofolate reductase, which have a role in DNA synthesis. Examples of drugs that have been designed against nucleic acid polymerase include cytosine albinoside and 5-fluorouracil and 6-mercaptopurine and thioguanine. There are a lot of drugs in this category. Okay. So, this is the brief classification of antimetabolites, in which there is a first class is antifolates, and it includes total 3 molecules: methotrexate, pemetrexate and pralatrexate. In purine antagonist, there are 2 molecules are widely used as a treatment for cancer. It is a mercaptopurine and thioguanine. In pyrimidine antagonist class, there are 3 molecules: fluorouracil, floxuridine and capecitabine. While in DNA methyltransferase inhibitors, there are 3 molecules: azacitidine, dacicitabine and nelarabine. While in DNA polymerase inhibitors, there are total 5 drugs, in which cladribine, clofarabine and both drugs belongs to the pyrimidine. Both drugs have a pyrimidine nucleus, while cytarabine, fludarabine and gemcitabine have a purine nucleoside. Then there is a few molecules are categorized under the as a miscellaneous antimetabolites, and examples for that is hydroxyurea and pentostatin. Now, this is a general mode of action of the antimetabolites. The anti-neoplastic agents have all damage existing DNA or less commonly RNA, are inhibited its ability to replicate, means they terminate the DNA chain synthesis. So, it is definitely inhibit its ability to replicate of cell. The antimetabolites on the other hand most commonly stop the de novo synthesis of DNA by inhibiting the formation of the nucleotides that make up this life sustaining polymers. We will see that the rate limiting enzymes of nucleotide biosynthesis are often the primary target for the antimetabolites, since inhibition of these key enzymes is the most efficient way to shut down any biochemical reaction sequence. Antimetabolites are also capable of inhibiting other enzymes required in the biosynthesis of DNA, and many can arrest chain elongation by promoting the incorporation of false nucleotides into the growing DNA strand. The antimetabolites serve as false substrate for critical nucleotide biosynthesis enzyme. These enzyme inhibitors are structurally dolled up, means it is similarity to look like a super attractive version of the normal endogenous substrate. Means as an example, if we consider the 6-mercaptopurine, so its structure is similarity to adenosine. So, in last point it is indicate that these enzyme inhibitors are structurally developed to look like a super attractive version of the normal endogenous substrate, means it is a endogenous. Then due to structure similarity, the binding site of the enzyme to choose them over the endogenous substrate, and once they do, the antimetabolites bind them irreversibly or pseudo irreversibly. Means after the enzyme there is a competition at the enzyme active site for binding a molecules. So, if they compete with the normal endogenous nucleotides, and instead of normal endogenous nucleotide they bind with the enzyme site, and it is bind irreversibly or pseudo irreversibly, and it incorporated into the DNA synthesis or RNA synthesis, and due to false incorporation there is a auto repair system of DNA takes on, and it stop the DNA synthesis. So, this is the basic phenomena behind the anti-metabolite action. We continue from the next for next line. If the building block nucleotides cannot be synthesized, then DNA synthesis is stopped dead in its track. If tumor growth is arrested, then metastasis slow, and the patient has a fighting chance for remission and a cure. Okay. So, many antimetabolites, antineoplastic are categorized by the class of nucleotide they inhibit. So, purine antagonist means they inhibit the purine nucleotide. Pyrimidine nucleotide antagonist means they inhibit the pyrimidine nucleotide. Some drugs belongs to the DNA polymerase inhibitors, some drugs belongs to DNA Methyltransferase Inhibitors, means they do this specific action on the enzymes by the inhibition of those enzymes. Okay. Now, purine antagonists inhibit the synthesis of purine based nucleotides adenosine monophosphate and guanosine monophosphate, and the pyrimidine antagonists stop the production of the pyrimidine based nucleotides, primarily deoxythymidine monophosphate. Now, we are going to discuss about the first subtype, folate antagonist. Mode of action of folate antagonist: methotrexate is a potent inhibitor of dihydrofolate reductase enzyme. The enzyme responsible for the reduction of folic acid to dihydro and tetrahydrofolic acid, precursor to 1 carbon donation in purine and pyrimidine de novo synthesis. Generally, basically folic acid, tetrahydrofolic acid required for the transfer of 1 carbon atom to purine and pyrimidine nucleotides in the normal way of de novo synthesis of DNA. While methotrexate drugs inhibit the DHFR enzyme. When DHFR enzyme inhibit, due to this there is a not possible to synthesis of tetrahydrofolate, and if tetrahydrofolate is not available, then there is a not possible to transfer of 1 carbon atom to the purine and pyrimidine molecules. That is why there is a synthesis of purine and pyrimidine nucleotides and DNA synthesis going to stop. Methotrexate is an analog of folic acid, where the 4-hydroxyl group on the pteridine ring of folic acid has been replaced by an amino group. So, you can see here, this is the 4 group, where amino group is available in methotrexate, while in folic acid there is a hydroxyl group. So, hydroxyl group is replaced by the amino group, and another, the nitrogen atom at the 10 position is methylated. So, nitrogen position you can see here, this is the 10 position. Okay. It is a methylated, while in folic acid there is a protonated. So, it is there is a secondary amine available, and in methotrexate there is a tertiary amine available. Okay. This substitution led to methotrexate having an affinity for DHFR orders of magnitude greater than that for the natural metabolites folic acid, and allow it to be an extremely potent inhibitor of DHFR. In this category, there are 2 more drugs pemetrexate disodium and pralatrexate. Okay. So, this both drug also comes under the category of folate antagonist, but basically most widely used drug is methotrexate. Now, use of folate antagonist, it is effective in many malignancy, breast, head, neck, colorectal, non-Hodgkin's lymphomas, osteosarcoma, bladder and choriocarcinoma are treated with methotrexate. It is also used in acute lymphocytic leukemia and some type of meningeal carcinomas. So, this is the main use of methotrexate and most widely used methotrexate drug as a folate antagonist. Now, side effects of folate antagonist, it's cause loss of appetite, nausea or vomiting, skin rash which may itch, diarrhea or constipation, sores in the mouth or throat, hair loss. This is reversible and hair will grow back when treatment ends, change in the way food tastes and weakness or fatigue. Now, we are going to discuss about the pyrimidine antagonist. Mode of action, most widely used drugs from this category is the 5-fluorouracil. So, 5-fluorouracil is an analog of pyrimidine based uracil, where the hydrogen at the 5th position in uracil has been substituted by bioisosteric fluorine atom. This makes 5-fluorouracil look very similar to uracil. So, you can see here at 5th position in 5-fluorouracil there is a fluorine, while in uracil nucleus you can see here there is a proton. So, this is the basic difference between the 5-fluorouracil and uracil nucleotide, but due to structural similarity 5-fluorouracil inhibit the thymidine synthase enzyme by the binding with it in compared to competition with uracil. So, it bind with thymidine synthase enzyme and block the synthesis of DNA. Now, 5-fluorouracil after conversion of 5-fluorodeoxyuridine monophosphate becomes an inhibitor of thymidine synthase, the enzyme involved in the de novo synthesis of thymidine. In this case, 5-fluorodeoxyuridine monophosphate is an antimetabolite of deoxyuridine monophosphate. So, 5-fluorouracil is converted to 5-fluorodeoxyuridine monophosphate, which compete with the precursor of deoxy trithymidine monophosphate, deoxyuridine monophosphate for thymidine synthase enzyme. This competition result in decrease in deoxythymidine monophosphate, which affects tumor cell DNA synthesis. So, generally what happen in the DNA synthesis, there is a deoxythymidine monophosphate incorporated into DNA synthesis, but 5-fluorouracil instead of incorporated 5-fluorouracil incorporated into DNA synthesis instead of deoxythymidine monophosphate, which is the natural endogenous molecules, and affect the tumor cell DNA synthesis. So, this is the examples of pyrimidine antagonist. Number 1 is fluorouracil, number 2 is floxuridine, number 3 is a capecitabine. So, floxuridine is a basically fluorouracil converted into floxuridine after the metabolism in vivo. So, and capecitabine also metabolized into in vivo, it is goes to floxuridine. Floxuridine, this deoxyribonucleoside product is bioconverted via today's deoxyuridine kinase mediated phosphorylation to the same active 5-fluorouracil deoxyuridine monophosphate structure generated in the multi-step biotransformation of fluorouracil. Capecitabine, also capecitabine is a carbamylated analogs of cytidine. The drug actually is another 5-fluorodeoxyuridine monophosphate prodrug. So, basically fluorouracil and capecitabine both are going to convert into floxuridine in vivo. Now, use of pyrimidine antagonist. Fluorouracil is administered intravenously in the palliative treatment of colorectal, breast, stomach and pancreatic cancers. Capecitabine is indicated for use as first line therapy in patient with colorectal cancer. It is also used alone or in combination with docetaxel in patient with metastatic breast cancer. Fluoxetine used in palliative treatment of GI adenocarcinoma that has metastasized to the liver and that cannot be managed surgically. Now, side effect of pyrimidine antagonist. 5-fluorouracil has major toxicity related to bone marrow depression, tomatosis, esophageopharyngitis and potential GI ulceration. Nausea and vomiting are common. Capecitabine, in addition to bone marrow suppression, nausea and vomiting, the drug can induce severe diarrhea and a potential disabling disorder termed hand and foot syndrome. Now, we are going to discuss about the purine antagonist. Purine antagonists inhibit the de novo biosynthesis of AMP and GMP. AMP means adenosine monophosphate and GMP means guanine monophosphate. The rate limiting enzyme in the synthesis of these purine nucleotides is amidophosphorybosyl transferase, also known as phosphoribosyl pyrophosphopeptide amidinotransferase, which is major target for one of the two thiol containing purine anticancer metabolites. Examples from this class is mercaptopurine and thioguanine. Mercaptopurine is used in the treatment of acute lymphatic myelogenous leukemia and thioguanine is administered orally in treatment of non-lymphocytic leukemias. Side effect of mercaptopurine and thioguanine have both showing the bone marrow suppression and it is the major use limiting toxicity of this purine antagonist. Also, these drugs can be hepatotoxic in high dose. Now, we discuss about the DNA Methyltransferase Inhibitors. 3 nucleic acid based chemotherapeutic agents azacitidine, dacitabine and nelarabine block abnormal cellular proliferation by inhibiting DNA alkylation, specifically methylation on genes responsible for differentiation and growth. The hypomethylation effect mediated through the inhibition of DNA methyltransferase can sometimes restore normal gene function while selectively killing cells that have stopped responding to the body's cellular proliferation control process. All of the marketed DNA methyltransferase inhibitors are nucleoside analogues that once converted to triphosphate nucleotides and are mistakenly incorporated into DNA in lieu of their cytidine or guanine nucleotide counterparts. So, interaction of the false nucleotide with methyltransferase result in an irreversible inhibition of the enzyme. So, from this class you can see here this 2 pyrimidine nucleotide and one was pyrimidine purine nucleoside. They inhibit the methyltransferase to particular DNA gene, okay, and they inhibit the DNA synthesis. Now, use and side effect of the DNA methyltransferase inhibitor. Nelarabine is considered a third line treatment for T cell acute lymphoblastic leukemia or lymphoma. The drug can induce severe and potentially irreversible neurological symptoms including convulsion. Azacitidine and dacitabine for the treatment of myelodysplastic syndrome. Both drugs have hematologic and renal toxicity. Now, we are going to discuss about the DNA polymerase DNA chain elongation inhibitor. Mode of action: 5 halogenated and a ribose modified DNA nucleoside analogues are marketed for the treatment of a wide variety of hematological cancer and solid tumors. These agents have a complex and multifaceted mechanisms. All include inhibition of DNA polymerase and DNA chain elongation among their action, and all nucleoside must be converted to triphosphate nucleotides before activity is realized. So, cytarabine, gemcitabine, fludarabine, cladribine and chlorpyrabine, these all 5 molecules have a halogen nucleus or they have a ribose nucleus. So, it looks like similar the normal nucleotides of the DNA, and they converted into triphosphate form and incorporated into the DNA, and when they incorporate into DNA and they inhibit the DNA polymerase enzyme. DNA polymerase enzyme is specifically responsible for the DNA chain elongation. So, when this enzyme going to block or its action going to inhibited, at that time the DNA synthesis or DNA chain elongation going to stop. So, that is by this way these all drugs produce the anti-cancer action. Okay. So, in the cytarabine you can see here there is a ribose sugar are attached with the nucleus. In the gemcitabine, ribose nucleus with the halogenated moiety are attached with it. Okay. So, cytarabine and gemcitabine both belongs to the pyrimidine class, while fludarabine, cladribine and chlorpyrabine belongs to the purine nucleotide. Okay. In this category, there is a cytosine albinoside are widely used, and cytosine albinoside is first converted to its triphosphate, and as such it functions as an antimetabolite for deoxycytidine triphosphate to inhibit DNA polymerase. As can be seen from its structure, cytosine albinoside is the albino isomer of cytidine. So, you can see here this is the cytosine albinoside and this is the deoxycytidine. Okay. So, there is a structural similarity with the cytosine, okay, but there is a just difference is that in this cytosine albinoside there is a 2' hydroxy group present. This is the 2' hydroxy group, while in the cytidine molecules there is a 2' hydroxy group was absent. So, this is the basic configurational difference configurational and isomeric difference in the both molecules. So, we can again discuss it. As can be seen from its structure, cytosine arabinoside is the albino isomer of cytidine. Okay. So, it is a albino isomer of cytidine. So, front जो structure of pyrimidine nucleus is just similar with the cytidine, but in albinoside structure albino isomer there is a difference at the 2' hydroxyl group. Okay. So, it is a due to this stereochemical change in the placement of the 2' hydroxy group, cytosine arabinoside resembles more to deoxycytidine rather than cytidine. In this way, cytosine arabinoside inhibit DNA polymerase by competing with deoxycytidine. Fludarabine, cladribine and chlorpyrabine, these 3 halogenated adenosine base nucleoside undergoes conversion to the active triphosphate nucleotides after active transport into the tumor cells. All are initially phosphorylated by deoxycytidine kinase, and cells with high level of this enzyme should respond well to this enzyme. Now, use gemcitabine is indicated in the treatment of breast, pancreatic and non-small cell lung cancers. Cytarabine is used in the treatment of acute lymphocytic myelogenous and chronic myelocytic leukemias, as well as used in non-Hodgkin's disease or Hodgkin's lymphoma. Cladribine is indicated in the treatment of hairy cell leukemia. Fludarabine phosphate is used in chronic lymphocytic leukemia. Clofarabine is used in acute lymphoblastic leukemia, patient who are 21 years or less. So, basically these all molecules are used in hemolytic or hemopoietic cells cancer or cancer related to blood. Okay. Mainly side effects is like its form of respiratory and cardiac toxicity can occur secondary to cytokinin release. Toxicity can progress to potentially fatal capillary leak syndrome and organ failure. Now, miscellaneous antimetabolite. In the miscellaneous antimetabolite class, there are two molecules available. Number one is pentostatin and another is hydroxyurea. Pentostatin is a ring expands purine ribonucleoside. So, you can see here purine having a 7 carbon containing 7 atom containing molecules, while pentostatin having 8 atoms in the molecules. So, that is why it was called as a ring expands purine ribonucleotide that inhibit adenosine deaminase and is primarily used in the treatment of hairy cell leukemia. The elevated level of deoxyadenosine triphosphate that result from inhibition of this degradative enzyme inhibit the action of ribonucleotide reductase. So, halting DNA synthesis within the tumor cell. When used in chronic lymphocytic leukemia, some authors and researchers claim pentostatin offer a therapeutic efficacy comparable to fludarabine, but with a lower risk of toxicity. So, means this molecule is more safe compared to fludarabine. Now, another molecule is hydroxyurea. Hydroxyurea, a drug with a 100+ year history, block the synthesis of DNA by trapping a tyrosyl free radical species at the catalytic site of ribonucleotide reductase, thereby inhibiting the enzyme that convert ribonucleotide diphosphate into their corresponding deoxyribonucleotides. It is used orally for the treatment of melanoma metastatic or inoperable ovarian cancer, resistant chronic myelocytic leukemia, and as an adjacent to radiation in the treatment of squamous cell carcinoma and cancer of the head and neck. Thank you. So, dear students, we will discuss this full topic antimetabolite in tomorrow interactive session. Okay? Thank you.